Are you worried that HIV might spread during intimacy or even in everyday situations like kissing or sharing food? If that fear has ever crossed your mind, you're not alone. Even in 2025, millions of Americans still live with silent doubts about how HIV actually spreads. Some believe one mosquito bite could change their life forever. Others hesitate to hug a friend or touch a coworker's hand. These myths don't just create unnecessary fear, they fuel stigma, they isolate people, and they stop us from focusing on the real risks. I'm Dr. Jame, and today I want to clear away the noise. In this video, I'll show you the 4 biggest myths about HIV transmission and replace them with facts you can trust. My goal isn't just to inform you, but to give you confidence and peace of mind. By the end, you'll know exactly what puts you at risk and what doesn't. You'll discover how prevention and modern treatment make living safe and healthy possible. So, stay with me, because what you're about to learn may save you from years of fear and even save lives. The deepest fear people rarely admit is this: what if sex with someone I love puts me at risk of HIV? That quiet worry keeps couples from enjoying intimacy and leaves singles afraid to date. But here's the reality. The danger isn't where most people think it is. And once you understand the truth, confidence replaces fear. Myth #1. HIV spreads through kissing or sharing food. Sophie messaged me last week terrified after a first date. We kissed. Is that enough to get HIV? That fear is common, and it steals joy from healthy relationships. Here is the science. HIV is not transmitted by saliva, sharing utensils, cups, or casual contact. Saliva contains enzymes and antibodies that break the virus down, and the amount of virus present in the mouth is far too low to infect someone. Everyday gestures, hugging, holding hands, sitting next to someone, using the same bathroom, do not spread HIV. Where does the confusion come from? Movies, rumors, and the natural instinct to avoid risk. When we do not know what is dangerous, we label everything dangerous. That reaction makes sense emotionally, but it is not accurate medically. There is one exception people ask me about: deep kissing when there is a visible blood from cuts or sores in the mouth. Even then, transmission is extremely unlikely, because saliva dilutes and inactivates the virus. But if there is blood involved, the conservative choice is to pause, clean up, and let the tissue heal. So, what should you do if intimacy triggers worry? Focus on what actually carries risk: blood, semen, vaginal fluids, and breast milk. For kissing and everyday sharing, relax, connect, enjoy, and communicate. Save your energy for real protection where it counts, like condoms, testing, and, if appropriate, PrEP. I'm Dr. Jame, and the more clearly you understand this, the more confident and kind your relationships can be. Knowledge also stops stigma. When families, partners, and coworkers understand the real roots, they stop avoiding harmless contact and start supporting prevention that actually works: everyday habits. Myth #2. HIV spreads through mosquito bites. Every summer, especially in states like Florida or Texas, my clinic inbox fills with the same question. Dr. Jame, we're seeing mosquitoes everywhere. Could they carry HIV from one person to another? This fear makes sense. After all, mosquitoes spread malaria, dengue, and Zika. So why not HIV? Here's the scientific answer. HIV cannot survive inside a mosquito's body. It doesn't replicate in insects the way malaria parasites do. When a mosquito bites someone with HIV, the virus enters the insect's gut and is rapidly destroyed. There is no way for it to be injected into the next person. Even the Centers for Disease Control and Prevention has stated repeatedly, no cases of HIV transmission through mosquito bites have ever been documented worldwide. Why does this myth persist? Because it seems logical. We see blood, we see bites, and our brains connect the dots. But medical science shows the dots aren't connected here. The biology simply doesn't allow it. If you're worried about mosquitoes, protect yourself from the real diseases they do spread. Use repellent, wear long sleeves, drain standing water, but for HIV, you can relax. The real roots are blood-to-blood contact through needles, sexual fluids, and from mother to baby, not insects. I'm Dr. Jame, and my mission is to separate fear from fact. When you know the truth about how HIV actually spreads, you stop wasting energy on impossible risks and start focusing on the ones you can control. That shift doesn't just protect your health, it gives you peace of mind and helps end stigma in your community. Myth #3. HIV only affects certain groups. One of the most damaging myths I hear in my research is this: HIV is only a gay man's disease, or only drug users get it. That belief is dangerous because it makes everyone else feel immune. Let me tell you a real case. A woman in her early 40s came into my clinic for routine blood work. She was married, had 2 children, and lived what many people would call a low-risk life. She was shocked when her test came back positive. Her infection did not come from her identity, it came from a single exposure she never thought possible. Here is the truth: HIV does not discriminate by gender, sexual orientation, race, or age. It spreads only when the virus has a route into the bloodstream. That means anyone, a college student, a business executive, a stay-at-home parent, can be affected if exposure occurs. This myth also fuels stigma. When society labels HIV as belonging to other groups, it delays testing, blocks honest conversations, and isolates people who need support the most. Breaking this myth allows everyone to see risk clearly and act responsibly. I'm Dr. Jame, and I want you to remember, HIV is a virus, not a judgment. It follows biology, not stereotypes. And if you think judging risk by appearance is safe, wait until you hear the next myth. It's about believing you can see HIV just by looking at someone. Myth #4. You can tell if someone has HIV just by looking at them. This myth may be the most dangerous of all. People still whisper, "He looks too thin. Maybe he has HIV." Or they avoid someone who seems tired or sick. That belief doesn't just hurt feelings. It destroys lives. Here's the fact: you cannot know who has HIV simply by looking. Some people live with HIV for years without showing a single symptom. With treatment, many remain healthy, energetic, and indistinguishable from anyone else. Even in advanced stages, weight loss or fatigue could be caused by dozens of other conditions. Judging by appearance is not just inaccurate, it's reckless. I once counseled a man who refused to get tested because he looked fine. By the time he finally took the test, his immune system was already badly damaged. Early treatment could have protected him, but the myth that healthy means HIV-free delayed his care. Here's what matters: testing, not guessing. Only a proper HIV test can confirm your status. That's why regular testing is recommended for anyone who's sexually active. Knowing your status isn't shameful, it's responsible. I'm Dr. Jame, and breaking this myth is about more than health, it's about dignity. It's about treating people with respect, not suspicion. Now that we've cleared the fog of fear and exposed the myths, let's move to the truths. The real ways HIV actually spreads, and how you can prevent it with confidence. If you're still with me, thank you. It means you care about truth over fear. And I want you to know, your voice matters. Comment on any video to share what you need help with. For privacy, just drop a 1 if this content is helpful, a 0 if you think it needs improvement, or add any concern you'd like me to cover. Now, before we dive into the truths about HIV, let me first show you how to recognize the real signs that matter. Truth #1. The real routes of HIV transmission. Let's be clear. HIV does not spread through hugs, kisses, food, or mosquitoes. It spreads in very specific ways, and if you remember these, you can protect yourself with confidence. There are 4 real routes. Blood-to-blood contact, most often through shared needles or contaminated medical equipment. Sexual fluids, semen and vaginal fluids during unprotected sex. Mother to child, during pregnancy, childbirth, or breastfeeding. Breast milk, direct transfer from mother to infant. That's it. Not handshakes, not toilets, not sweat or tears, only these 4. When I repeat this to my patients, I see relief on their faces, because once you know the actual routes, you stop worrying about the impossible ones. Here's why this matters. Focusing on the real routes helps you take real action. If you know sex without protection carries risk, you use condoms or ask about PrEP. If you know sharing needles is dangerous, you avoid it completely. If you understand mother-to-child transmission, you encourage testing during pregnancy so treatment can prevent it. I'm Dr. Jame, and I want you to remember this line. HIV spreads only through blood, sexual fluids, pregnancy, or breastfeeding. Nothing else. Repeat it. Teach it. Because the clearer this truth becomes, the faster stigma disappears and prevention succeeds. And once you understand the real routes, the next step is just as important. Knowing your status through testing. Truth #2. The importance of testing. Too many people wait until symptoms appear before thinking about HIV. That delay can be deadly. The only way to know your status is through a test. Not through guessing, not through how healthy you look or feel. I've counseled patients who avoided testing out of fear. They thought, if I don't test, maybe I don't have it. But silence doesn't protect you. HIV doesn't stop just because you avoid the answer. In fact, the virus works quietly, damaging the immune system year after year until the body can no longer fight back. Now, here is the good news. Early testing changes everything. If detected early, HIV treatment reduces the virus to undetectable levels. That means your health is protected, and you cannot pass the virus to your partner. This is why testing isn't just about you. It's about everyone you love. Think of it as a mirror. A test reflects the truth, whether good or bad, and truth gives you control. Without it, you live in uncertainty. With it, you gain a plan. I'm Dr. Jame, and my strongest advice is this. If you're sexually active, get tested at least once a year. More often if you have multiple partners or share needles. Testing is not shameful. It's responsible, powerful, and life-saving. Because the moment you know your status, you take back control. And once you have that control, the next question becomes, what can you do every day to prevent HIV in the first place? Truth #3. Prevention works. Condoms, PrEP, and PEP. If you want to protect yourself from HIV, the tools already exist. The question is, are you using them? First, condoms. They remain one of the most effective barriers blocking sexual fluids, semen and vaginal fluids, which are primary routes for HIV. But effectiveness depends on consistency. Using a condom most of the time is not enough. It has to be every time, from start to finish. Second, PrEP, pre-exposure prophylaxis. Think of it as a daily pill that creates a shield in your body. When taken correctly, PrEP reduces the risk of HIV from sex by about 99%. I've had patients who once lived in fear finally relax, enjoy intimacy, and build relationships with confidence because PrEP gave them peace of mind. Third, PEP, post-exposure prophylaxis. This is the emergency plan. If you believe you've been exposed, maybe a condom broke, maybe a needle injury, you must act fast. PEP works only if started within 72 hours, and the sooner the better. It's a 28-day treatment that can stop HIV before it takes hold. I'm Dr. Jame, and my warning is simple. Prevention works only if you use it. HIV today is not about fate. It's about choices. Condoms, PrEP, PEP. These are choices that save lives. And here's what may surprise you most. With modern treatment, people living with HIV can reach a point where they can't pass it on at all. That truth will change everything you thought you knew. Truth #4. Treatment =. Undetectable =. Untransmittable. You =. Here is the truth most people still don't believe. With proper treatment, people living with HIV can reach a point where the virus becomes undetectable in their blood. And when it's undetectable, it's untransmittable. That means zero risk of passing HIV to a sexual partner. Zero. This is called U =U. Undetectable equals untransmittable. Modern antiretroviral therapy lowers the amount of HIV in the body so effectively that blood tests can't find it. At that stage, the virus has no chance to spread. This is not just theory, it's proven by years of global research. Why is this so important? Because it replaces fear with hope. People with HIV can marry, have children, and live full, healthy lives without transmitting the virus. It destroys the old stigma that HIV means isolation or danger to others. But there's a condition. Treatment must be consistent. Missing doses can allow the virus to rebound. That's why regular medical care, adherence to medication, and routine monitoring are essential. I'm Dr. Jame, and here's my message. HIV is not the end. With testing, prevention, and treatment, it is manageable, and it is no longer a death sentence. And to prove how powerful this truth is, let me share a real story. A case study of someone whose life was transformed by replacing myths with facts. Angela was 36 when she first came to my clinic. She was convinced she couldn't have HIV. She was married, worked full-time, and never thought of herself as at risk. But during a routine test, the result came back positive. She was devastated, terrified her family would abandon her. Here's what happened next. We started treatment immediately. Within 6 months, her viral load dropped to undetectable. She regained her energy, returned to work, and today she's raising 2 healthy children. You may not believe this, but it's true. Angela cannot transmit HIV to her husband because her treatment keeps the virus silent. I'm Dr. Jame, and I've seen stories like this again and again. Facts replace fear, and treatment turns despair into life. We've covered a lot, so let's bring it all together. First, the myths, the lies that cause fear and stigma. HIV does not spread through kissing or sharing food. It does not spread through mosquito bites. It does not target only certain groups. And you cannot see HIV just by looking at someone. Those myths are false, and believing them only creates harm. Now, the truths, the facts that protect you. HIV spreads only through 4 real routes: blood, sexual fluids, pregnancy, and breastfeeding. Testing is the only way to know your status, and early testing saves lives. Prevention works. Condoms, PrEP, and PEP are powerful tools, and treatment is stronger than fear. With U =U, undetectable means untransmittable. That truth destroys stigma and gives hope. If you remember nothing else, remember this. Myths divide people, but facts save lives. When you know the difference, you protect yourself, your partner, and your family. I'm Dr. Jame, and I want to leave you with one challenge. Think of one person you know who still believes an HIV myth. Share this video with them. Start a conversation, because ending HIV isn't just about medicine, it's about breaking silence together. And your voice matters here too. Comment 1 if this video helped you, 0 if it needs improvement, or share the myth you've heard most. Your comment could guide the next video and help someone else find the truth. Together, we can replace fear with knowledge and stigma with hope.